Welcome to Session 2. In this presentation, we will discuss steps to solving a medical coding exam case study. But first, I want to introduce you to the team. First up, Mr. Sandeep. Mr. Sandeep coming to you live from Abu Dhabi. He is an AMCI co-lead instructor. Next up, Miss Eva coming to you live from the state of Florida. She is also a co-lead instructor and the intern coordinator. And finally, myself, Mrs. J. I'm the curriculum director at AMCI. Now, let's meet the AMCI interns. We have Miss Anubama, followed by Miss Carla, Miss Courtney, Miss Dolly, Miss Vivian, and Miss Melissa. And the goals of the presentation are to review integumentary, musculoskeletal, and respiratory scenarios. Now let's talk about how to solve a multiple choice case study scenario the AMCI way for the board exam. This is how we do it. We teach you to highlight your key terms, and this key on the right tells you the colors that you should use and for what. A yellow highlighter should be used for diagnoses, all diagnoses, signs, and symptoms. The green will be for procedures. So if you have a green highlighter, the green will be used to highlight only procedures. And pink, these are inclusive or bundled items. All right? Once you've done your highlighting, you're going to have to document your inventory. That's your procedures, diagnoses, and select a primary code. Which diagnosis is primary, which procedure is primary. Then you're going to review all pertinent guidelines. And finally, the code that best matches your inventory list is often the correct code, or a code that is pertinent to a guideline. That will be your best code. All right. So here are some do nots. When you're highlighting, you can kind of get discombobulated. So we've compiled some things that you don't even have to highlight. Number 1, don't highlight things observed by the physician because you cannot code for them. Number 2, don't highlight closures. If a provider or surgeon is closing up a surgical site, there's no need to highlight it. However, if it involves a skin procedure or skin defect closure, you may definitely have to code that. So if it's closing a surgical site other than skin defects or wounds or lesions, you do not code it or highlight it. Also, you don't highlight bleed control, hemostasis, because that's pretty customary and it's bundled into the procedure code. You don't highlight drains, irrigation of the surgical site. Nope. And you don't highlight installation and removal of clamps and trocars because these are used to open up or maintain the surgical or operative site so the physician can view what they're doing, particularly if it's an open procedure. Also, you don't highlight dressings. And finally, you do not highlight surgical risks. Now that we've gotten that out of the way, I think you're ready to get started, and I'm going to hand it over to Mr. Sandeep. All right, Mr. Sandeep, take it away.
Let's move on to the next section, musculoskeletal system. And for the first scenario, I would invite Miss Courtney onto the floor. Miss Courtney, floor is all yours.
All right, coders. What CPT and ICD-10 CM codes are reported? A28002, modifier LT, M72.2, B 28060 modifier LT M72.2, C 28062 modifier LT M72.2, D 28008 modifier LT M72.2. Pre-operative diagnosis, plantar fasciitis, left foot. Post-operative diagnosis, same as pre-operative diagnosis. Procedures, plantar fasciotomy, left heel. For informed consent, the more common risks, benefits, and alternatives to the procedure were thoroughly discussed with the patient. An appropriate consent form was signed indicating the patient understands the procedure and its possible complications. The 61-year-old male was brought to the operating room and placed on the surgical table in a supine position. Following anesthesia, the surgical site was prepped and draped in the normal sterile fashion. Attention was directed to the left heel where, utilizing a 61 blade, a stab incision was made, taking care to identify and retract all vital structures. The incision was deep into the medial band insertion of the fascia. The fascia was then incised and avulsed from the calcaneus. The surgical site was flushed with saline. Next, 1 cc of depot-medrol was injected in the operative site. The site was dressed with a light compressive dressing. Excellent capillary refill to all of the digits was observed without excessive bleeding noted. Hemostasis, none. Estimated blood loss, minimal. Injectables. Agent used for local anesthesia was 5.0 cc Marcaine, 0.5% with epinephrine. Pathology, no specimens sent. Dressings, applied bacitracin ointment. Site was dressed with a light compressive dressing. Condition, patient tolerated the procedure and anesthesia well. Vital signs were stable. Vascular status was intact to all digits. Patient recovered in the operating room. All right, coders, your time starts now.
And coders, I think that's time. And what a flawless way to read the operative scenario. I'm sure I won't be able to read operative report in such a manner, such a beautiful manner. Miss Courtney, thanks a lot. And coders, I see like you didn't need it 2.5 minutes to solve this one. Great to see that once again. So let's solve the scenario. You know the drill. The first step, highlighting the keywords. We have the preoperative and postoperative diagnosis. Same, plantar fasciitis of left foot. The procedure performed is a plantar fasciotomy, left heel. The patient was placed in a supine position and anesthesia was given. The stab incision was made. The incision was deepened. The fascia was then incised and avulsed from the calcaneus. Next, 1 cc of depomedrol was injected in the operative site. And as majority of you have said, the correct answer is option D. Now let's move and solve the scenario. Second step. Before that, okay, what is plantar fasciitis? This is one of the condition which I see most commonly people coming up with. So it is an inflammation of the fibrous tissue, which is a plantar fascia along the bottom of your feet that connects the heel to your toes, heel bones to your toes. So for plantar fasciitis, what the surgeons do is a plantar fasciotomy, which is an incision that is made on your fascia, which is detached from the heel bones. So for a plantar fasciotomy, that will relieve the pain of the heels or your foots. That was just for your information. Okay, select the code that best matches your inventory. This is going to save your lives during the scenarios. Second step, the procedure inventory, plantar fasciotomy, left heel, diagnosis inventory, plantar fasciitis, left foot. Looking into the first code, 28002, that is incision and drainage below the fascia. Cross-checking with the procedure inventory, fasciotomy is the one which is performed and it is not an incision and drainage. There goes option A. Now option B, 28060, faciactomy, plantar fascia partial. This is coding for a faciactomy procedures. And for the faciactomy procedures, let's cross-check the procedure inventory. We are having fasciotomy. It might look alike, but having a forensic look, this one is for ectomy, which is a removal. We had a fasciotomy. So there goes option B as well. And option C is also coding for a fasciectomy, a radical of the plantar fascial, a radical approach. Once again, the fasciectomy was not the procedure performed. And here we go. And option D, 28008, fasciotomy, foot or toe. Cross-checking with the procedure inventory, plantar fasciotomy, left heel. This is the procedure which we perform. That's what I said. Always select the codes that best matches your inventory. This was a little bit straightforward scenario. And if you have got your inventories correct, you could have arrived at the answer, correct answer, much easier for this one. Let me look into the chat. Okay, any questions, coders, for this one? That was a straightforward. Got to watch those E's and ICS. At times you have to be a little bit forensic. There will be small details which you have to look into. Yeah. Okay, coders, that was the first scenario in the musculoskeletal chapter. Let's move on to the second scenario. And let me invite Ms. Dolly to read out the scenario. Ms. Dolly, stage is all yours.
Okay, what CPT and ICD-10-CM codes are reported? A20525, T84.84XA, G89.18. Answer B, 20680, T84.84XA, G89.18. Answer C, 206.94, T84.84XA, G89.18. Answer D, 20670, T84.84XA, G89.18. Pre-operative diagnosis, painful hardware left foot. Post-operative diagnosis, painful hardware left foot. Procedure performed, removal of hardware left foot. Anesthesia, sedation, and local drain, none. Estimated blood loss, minimal. Indications for procedure. The patient is status post metatarsal fracture treated with internal fixation. Patient has suffered pain due to hardware for the past 6 months. Patient's pain has been unresponsive to conservative treatment. We discussed the above-mentioned surgery along with the potential risks and complications, and the patient understood and wished to proceed. Description of procedure. With the patient supine on the operating table after the successful induction of anesthesia, the left foot was prepped and draped in the usual sterile fashion. In the area of the screw heads, 0.5% Marcaine was injected, both on the lateral side of the foot and the dorsal midfoot, administering about 5 milliliters in each area. Small 0.5 centimeter incisions through the skin were made, and blunt dissection was carried down to the screw heads. The screws were removed with the screwdrivers. The incisions were irrigated and closed with simple 4-0 nylon sutures. A sterile compression dressing was applied. The patient was taken to the recovery room in satisfactory condition. Materials sent to the laboratory, none. Complications, none. Condition on discharge, satisfactory. Discharge diagnosis, painful hardware left foot. Discharge plan. Discharge instructions were discussed with the patient. A copy of the instructions was given to the patient and a copy was retained for the medical record. The following items were discussed: diet, activity, wound care, medications, when to call the physician, and follow-up care. All right, 2.5 minutes, coders, and your time starts now.
Thank you, Miss Dolly. Thank you for reading out that long scenario for us. And coders, let me say what was happening. Let me say a general review of what we saw in the chat. There was a tight race between option B and C. I thought it will be between some other options, but it was very, very tight race. And let's see who won the race. You can continue to put work on the scenario and place your answers in the chat. Meanwhile, let's solve. First up, highlighting keywords, preoperative and postoperative diagnosis are same. I'm sorry, we must highlight the postoperative diagnosis here. My mistake. So it will be painful hardware of left foot. The procedure performed is a removal of hardware of left foot. The patient is status post metatarsal fracture with an internal fixation device. With an internal fixation, the patient suffered pain due to hardware. He was placed in a supine position. Anesthesia was given. Small 0.5 centimeter incisions through the skin were made. The dissection was carried down to the screw heads. The screws were removed with screwdrivers. The condition on discharge, painful hardware left foot. And you know who won the race now? The correct answer is option B. And I will tell you how we got option B as a correct one. And this is what we are having, an internal fixation device. The internal fixation device may be used to keep the fractured bone stabilized and in alignment. The device is actually inserted surgically to ensure that the bones remain in an optimal position during and after the healing process. So those if anyone had any fractures which required any open treatment and with an internal fixation as well, know what an internal fixation device is. It might remain post surgery as well until you develop any complication. Doctors decide to remove them, and that's what an internal fixation device looks like. Coming to the coding portion, once again select the code that best matches your inventory, and let's see what we are having in inventory. The procedure inventory, we are having a removal of fixation left foot. And diagnosis inventory, we are having painful hardware left foot. And these are our code options. Let's look into the first one, 20525, which is coding for removal of foreign body, deep or complicated, in the muscle or tendon sheet, deep or complicated. You can see what it is coding for, removal of foreign body. We are having a removal of an internal fixation device. It's not an implant, or it's not a foreign body. That eliminates option A. And let's look into option C, which is 20694, which is coding for removal under anesthesia of an external fixation device. So if you become a little bit forensic, you can see why option C is a wrong one. It is coding for an external fixation device. And you can see over here, the patient was having a fracture, metatarsal fracture, and was treated with an internal fixation. So the implant which used here is an internal fixation device, not an external fixation. That's why we eliminate option C. Here it is where they say internal fixation. So option C is the wrong one. And let's look into option D. Remaining two is option D and B. Let's see what's option D is for. It's coding for 20670, which is removal of implant superficial. And option D is coding for 20680, which is a removal of implant deep. And the parenthesis, if you have a close look into the parenthesis, you can see what kind of implants are usually used. In the deep, we are having a screw. Over here, we are having a screw, and a screw is the one which is exactly removed in our scenario. The blunt dissection was carried down to the screw heads and the screws were removed. So generally the screws are like for a deeper section, and it is not going to be a superficial one. That is why we eliminated option D20670 and selected option B20680 as our answer. So the correct answer would be option B20680. Did you got some aha moment in this one, coders? Yes. Be forensic, get your inventories correct, inventory list correct, and select the code that best matches your inventory list. That is going to be your mantra. Okay, and now it's time for next scenario. Let's quickly move on. And if you're having any doubt on this one, please put your answer questions in the chats. And also, if you need a screenshot, please go ahead and take the screenshot of the scenarios, and it might help you later on. And for the next scenario, let me welcome Miss Melissa. Miss Melissa, stage is all yours.
Good evening, coders. So answers first. A, 27832 RT, S82391A, W19XXXA. B, 27827 RT, S82391A, W19XXXA. C, 27829 RT, S82391A, W19XXXA. D, 27814 RT, S82391A, W19XXXA. Pre-operative diagnosis, right ankle triplane fracture. Post-operative diagnosis, right ankle triplane fracture. Procedure, open reduction and internal fixation, right ankle triplane fracture. Anesthesia, general endotracheal. Complications, none. Specimen, none. Implant used, synths 4mm cannulated screws. Indications for procedure. The patient is a pleasant 15-year-old male who fell and sustained a right ankle triplane fracture. This was confirmed on both X-ray and CT scan. The indications for ORIF were explained to the patient, as well as the possible risks and complications, which include infection, bleeding, stiffness, hardware pain, the need for hardware removal, and there is no guarantee of a functional ambulatory result. The patient and family understood and wished to proceed. Procedure in detail. The patient was brought back to the operating room and placed on an operating table, given a general anesthetic without any complications, and given preoperative antibiotics per usual routine. He had the right lower extremity prepped and draped in the usual sterile fashion, with alcohol prep followed by betadine prep. Under X-ray guidance, a pointed reduction clamp was placed from the anterolateral corner of the distal tibia to the medial side, and I reduced the triplane fracture. It was confirmed on both AP and lateral X-ray images the gap was reduced. The patient then had guide wires taken from the synth's 4mm cannulated screw set. One was placed immediately along the epiphysis on the anterior half of the epiphysis and parallel to the joint to catch the lateral aspect of the epiphysis. One screw was placed above the physis from anterior to posterior to capture that spike. Once the wires were in the appropriate position, the length was measured and partially threaded 4mm cancellous screws were selected so all threads were across the fracture site. The appropriate length screws were placed, confirmed by an X-ray to be in good position. The fracture was anatomically reduced and the ankle joint was anatomic. The patient had wounds copiously irrigated. Closure was done with interrupted horizontal mattress 3-0 nylon suture. The patient had a sterile compressive dressing applied, was placed into a 3-sided posterior mold splint, was extubated, and brought to the recovery room in stable condition. There were no complications. There were no specimens. Sponge and needle counts were equal at the end of the case. CPT and ICD-10, what CPT and ICD-10 CM codes are reported. Okay, coders, you have 2.5 minutes. Your time starts now. Okay, coders, your time is up.
Thank you, Miss Melissa. Thank you for reading out that scenario for us. And let me look into the chats. I expect more answers coming up as we go through this scenario. Good work, coder, so far. Okay, let's do our first step. The post-operative diagnosis is right ankle triplane fracture, and the procedure performed is an open reduction and an internal fixation. Internal fixation right angle triplane fracture. It's an ORIF, open reduction. And in the procedures, we are having a right triplane ankle fracture, right angle triplane fracture. General anesthesia was given, and under the X-ray guidance, reduction of the reduction clamp was placed from the anterior lateral corner of the distal tibia to the medial side. I reduced the triplane fracture was reduced. Okay, then the patient then had the guide wires taken. One was placed medially along the epiphysis on the anterior half of the epiphysis. One screw was placed above the epiphysis. Once the wires were in place, were in appropriate position, partially threaded for 0.0 mm calcaneus screws were selected to all the threads. So all the threads were across the fracture site. So the correct answer to this question is option B. And I'm sorry, I was looking into the chats for a moment. That's a delay. And let's move on to the second step, coders. Procedure inventory. As you have seen, it is an open reduction and internal fixation was performed for a right angle triplane fracture. The diagnosis inventory, we are having a right angle triplane fracture. And this is the like anatomy of your bone of the leg, and I would like to bring up this in order to show the distal portion of the ankle. This is where the triplane fracture has happened. And this is what a triplane fracture actually looks like. It involves actually three planes. That's what it's called, a triplane fracture. You can see first, second, and the third. Okay, now let's come back to the coding portion. Option A, 27832. It is coding for an open treatment of a proximal tibiofibular joint dislocation. So what do you think, Goddess? Was it a dislocation treatment the doctor treated for? No, it was not a dislocation. It was a right angle triplane fracture which he treated. Yes, fracture. So looking into this particular portion, we can see this is not the correct one. This is the one which is coding for a treatment of a dislocation. There we go, right out of the box. Option A is a wrong one. Let's look into the next one. Option C, 27829. This one is also coding for an open treatment of distal tibiofibular joint disruption. And once again, we are not treating for disruptions. We are treating for a fracture. So just looking into the code language, we can eliminate option C as well. The remaining two options, which must have confused you all, is option B and option D. And the correct answer was option B, because option D, 27826, is coding for an open treatment of the fracture of weight bearing articular surface portion of distal tibia with internal fixation when performed of fibula only. And the option B, 27827, is coding for open treatment of fracture of weight bearing articular surface portion of distal tibia only. So this one is coding for fibula only, and 27827 is coding for a tibia only. So if you look into this particular portion where they are saying under the X-ray guidance, a pointed reduction clamp was placed from the anterior lateral corner of the distal tibia to the medial side. So from here you can pick up where the fracture reduction was performed. This was performed on the tibia rather than the fibula. And that is the key point here that help us know the exact location where the reduction was performed. It was only performed on the distal tibia and no fibula was involved. In that way, we can eliminate option D, and the correct answer would be option B, 27827. The explanation is the same as my thought process. Yes, glad to know that. We shall help. Thank you for the explanation. Any questions on this scenario, coders? Please take a screenshot if you need more time to solve this one. Help me with churning my book. Yes, that's what I've been saying. Churning helps a lot, especially in these long scenarios. It helps a lot.
Thank you, Mr. Sandeep, for those AMCI amazing and awesome explanations. Miss Eva, for being the orchestrator and conductor of the best interns on the planet. Yes, I said it. Miss Melissa, Anubama, Courtney, Carla, let's get it, let's code, Dolly and Miss Vivian. And let's not forget our interns in the chat, led by Miss Biji. And you, the students, you all are simply the best, and we appreciate you. And we will see you next time for more great scenarios. You don't want to miss it. And thank you for participating in the AMCI Medical Coding course. Until next time.